Hi, I'm Dr. Hagmar, and I want to welcome you to my practice. Perhaps you are watching this video and you're considering working with me or with one of the other doctors in our practice. These next few videos are going to help you understand how we approach chronic health problems, what we do, how we do it, why our approach is so different from all other of your past experiences, and why we may be the very last doctor office that you have to work with. But before I do that, I want to know if you can relate to a particular experience that I see day in and day out. Right? And it goes something along like this. You schedule an appointment with your doctor, which is taken perhaps a few weeks, maybe if it's an endocrinologist or some other kind of specialist, maybe it's taken a few months. And you show up to your doctor's appointment on time, and you wait, and then you wait, and you wait some more. And finally, you're taken to a room, an exam room, where, again, you wait for another 15 or 20 minutes. And at this point in time, maybe the nurse comes in, takes your vitals, your blood pressure, your pulse, your weight, your height, and she leaves and lets you know that the doctor will be right in with you. Now you wait another 5, 10, or 15 minutes. So you've just killed almost 45 minutes to an hour in the doctor's office, plus whatever time it took you to drive to that office. Finally, as the doctor is walking in the room, he or she is looking at your clipboard or his iPad or her iPad, attempting to review your file and your records. And I'm going to assume and even go out on a limb here and say that if you have a chronic health problem, something that you've been dealing with for quite some time, that this is not your first visit to this doctor's office, and that your health records are probably longer than 1 or 2 pages. Right? If you're like most of my patients who have chronic health problems, their records are more like encyclopedias. Right? They're big, filled binders, lots and lots of testing that's been done. So your doctor glances over this encyclopedia of records as the doctor is walking into the room. And of course, this is not sufficient enough time to actually try to understand where the real root cause of your problem lies. And so the doctor asks you, essentially, why you're there. What are you doing? What's the purpose of today's visit? And now if you're like me, you kind of start thinking, well, I just filled out all this paperwork. Did you read it? And so the doctor spends 10 or 15 minutes really asking you many of the same kinds of questions that you had already filled out in the paperwork. And at the end of the appointment, your doctor sends you on your way with either one of really these 4 scenarios. Number 1, a blood work requisition for you to have more blood work. Number 2, a drug prescription that will only treat your symptoms. Number 3, a referral to a specialist. Or number 4, and this is the worst case scenario, a pat on the back with the doctor telling you that everything looks good. Your blood work is normal. Your problem is psychosomatic. In other words, it's all in your head. Meanwhile, you're experiencing fatigue all the time. Your anxiety is going through the roof. You're gaining weight. You have daily brain fog. Your hair is falling out. You're bloated all the time. You're having all kinds of GI issues. You can't focus. You can't concentrate. You have a hard time of just making it through the day without having to take a nap or drinking several cups of caffeine. You feel anything but normal. And when you ask your doctor, how is it possible that I have all of these symptoms and yet my blood work is normal? And your doctor says, listen, Mary or John, you're just stressed out. We all experience this, and that's really what's going on. Your doctor sends you out the door with some kind of sleeping pill or some kind of antidepressant or anti-anxiety pill or some other drug that the drug rep just dropped off. And unfortunately, if this sounds familiar, what I just described sums up the typical healthcare experience. And for patients who have chronic health problems or multiple health problems, multiple chronic problems, how has that visit, how has today's visit in that doctor's office, how has that made you healthier? How has it changed your life? How has it given you direction? How is it going to address the real core problems that you've been struggling with for years? Did your doctor take time detailing what he or she plans to do differently? Did your doctor assess your nutrition? Did he or she just ignore your diet? Did they inquire about what you're eating? Or was today's visit just another one of those routine going through the motion visits? You see, a drug prescription is never going to fix your problem. It may manage your symptoms, which we've come to equate with healthcare. And of course, medications can sometimes do a very good job at managing our symptoms. But at the end of the day, at the end of the year, you're going to have the same problems and you will be sicker. Think about this. Is your health today, are you healthier today, Or are you sicker today than you were a year ago or 2 years ago? If all of this sounds familiar, well, this is your typical visit and your typical experience in a doctor's office in the 21st century. And it's the reason we have chronic diseases as the #1 cause of disability, the major cause of financial bankruptcy, and a major cause of chronic health problems that are just exploding worldwide. No wonder you still have no answers as to why you feel lousy and why you're just developing these new health problems year after year after year. You see, you can't begin to truly understand a patient's health problem or attempt to get to the root cause of that chronic health problem with this kind of routine office visit and a solution that only ends up with a drug prescription. That kind of healthcare is the wrong tool for the job. Chronic health problems have multiple layers and factors, which is why they're chronic. You can't medicate these away. And if you're watching this video and you have a chronic health problem, not only does that approach not work, most of the testing that's done, which is usually only blood work, will not provide you with the answers that you are seeking. So now that I just explained why chronic health problems don't respond to this kind of approach, let me spend a few minutes explaining how I and the other doctors that work alongside me approach chronic cases. Okay? First and foremost, #1, in my practice, prior to your appointment, I'll have already spent anywhere between 60 to 90 minutes reviewing all the records that you've had within the last 6 to 12 months. And we will be combing through those records. We'll be dissecting them and really looking into them. I will know your file inside and out, so we're not wasting time on that first visit. Now, because I've already spent this time studying the case prior to your visit, I've already reviewed your blood work, I've already reviewed previous exams, I've already reviewed all your medical records, I've had you complete a 7-day food journal, I've had you complete a 3 to 5 page health narrative, I've reviewed your health history. All of this was done prior to your appointment. Most of what we're going to do during that case review, we're going to discuss the tests that you need and why you need them, and how that information will help you find the answers that you're searching for. You see, most patients have not had testing that is tailored to their needs because most doctors haven't spent the appropriate time reviewing what those needs are. So 9 out of 10 times, the information needed to start a successful treatment plan was missing right out of the starting gate. You can't fix what you don't know. You see, an effective treatment plan, one that's going to address the root cause of your problem, is only going to work if that doctor runs the right tests and knows how and where and what kind of help your body needs. You can't guess about this, and you can't apply a cookie-cutter approach. This is why our new patient paperwork is the most thorough and comprehensive new patient paperwork that you will ever fill out. You can't expect to get well if your doctor doesn't know where the root cause of your problem might lie. You can't fix what you don't know, and this means your treatment plan, if not tailored to your individual needs, is ultimately going to be a failure. So during your case review, we'll talk about your past testing and what might have been overlooked. But more importantly, we're going to talk about how I want to approach your case and the specific metabolic testing and functional testing that will help us unravel the root causes of why you have a thyroid problem, or why you're chronically fatigued, or why you're feeling anxious, or why you're depressed, or why your stomach always hurts and feels bloated, or why you continue to gain weight, why you're suffering with brain fog and insomnia and are having these autoimmune flare-ups. When it comes to chronic health problems, again, every chronic health problem, every chronic condition for that matter, has multiple causes and multiple layers of metabolic dysfunction that need to be understood. And this is why specialized metabolic functional testing must be tailored to your needs. Just because you have the same symptoms that your next door neighbor has or the person that you work with, this does not mean the testing you need or the treatment that you're going to receive would be the same. You see, standard blood testing, the kind that your doctor runs perhaps every 6 months or year after year on you, is not as sensitive, and in most cases it will not provide us with the answers that we need in order to help you overcome this chronic health problem. Now, let me give you 2 examples of what I mean by all this, right? Let's say you have depression and you have anxiety and you've been noticing a decline in cognitive function, such as brain fog, right? What kind of testing did your doctor do in order to understand the cause of your anxiety or depression or brain fog? Did they run tests to identify neuroinflammation or some of the causes of inflammation? Did they do testing that would uncover perhaps certain nutritional deficiencies that might be associated with depression or anxiety? Did they evaluate or consider a leaky gut? Did they test your cortisol levels or your hormone levels? Did they talk about the role of diet and how certain foods can contribute to depression and anxiety and brain fog? Did they look at the potential of a chronic infection as a culprit? Did your doctor consider any of these layers? Or were all of these layers and potential root causes overlooked because your doctor did not look at the big picture or practice root cause healthcare? So here again, a prescription for Paxil, Prozac, Zoloft, Wellbutrin, or some other kind of antidepressant, anti-anxiety, or sleeping pill is not the fix. If this is happening to you or someone that you love, it shouldn't be. Now let me give you another example. Let's say you've been diagnosed with a thyroid problem. Let's say you have hypothyroidism. You have hair loss, and you have heart palpitations, you're cold, you're hot, you're depressed, you have no libido, you can't sleep, you're gaining weight. What kind of tests has your doctor run to determine the cause of your low thyroid? Aside from identifying that your hormone levels, your thyroid levels are low, what did your doctor do to uncover the cause of why those hormones are low in the first place? What is the cause behind your low thyroid? You see, what goes on in most healthcare systems today is that doctors simply top off your low thyroid levels without asking why you have low thyroid levels in the first place. One of the biggest problems that I see day in and day out is just what I mentioned. It's just simply giving thyroid hormones for levels that are low. In no way, shape, or form does that address the root cause. Again, how can you fix something which you don't know? Did your doctor test your thyroid levels? Did they test your antibody levels? Did they consider checking the metabolic function and detoxification pathways of your liver, which play such a vital role to thyroid function? Have they considered the relationship between thyroid and cortisol levels? Have they considered the possibility of intestinal hyperpermeability or leaky gut? Have they considered small intestinal bacterial overgrowth as to the cause of low thyroid levels? Did you know that certain medications, like levothyroxine, has been shown to cause bacterial overgrowth? And this can affect your thyroid levels? Does your doctor know why your T3 levels are low, or why your reverse T3 levels are high, or why your thyroid antibody levels are elevated? Or here again, did they just prescribe thyroid hormones for low thyroid levels and stop investigating the root cause, the why of the problem? Did they sit down and talk to you about nutrition, how and why certain vitamins and mineral deficiencies can affect your thyroid levels? Did they talk about certain foods that you might need to avoid? Did they talk about Hashimoto's as a potential cause? Right? Did they set you up with a nutritionist? How can you get better if the doctor that you're working with has not investigated these potential root causes? How can you fix what you don't know? Maybe the traditional approach works for managing your symptoms, but in both of these examples, you still have not determined and identified the root cause of your health problem. And until you do, you're not only going to get sicker year after year, if you feel that you're falling through the cracks with standard medical procedures, I'm here to tell you that it doesn't need to be this way. If you're interested in learning more about my practice and how I work with patients and the process of becoming a patient, please give me 10 more minutes of your time and watch the next video that explains the process in much more detail, okay? One last thing for those of you who have worked with a functional medicine doctor or an integrative doctor or a naturopath in the past, what I find is that if you're still struggling, if you don't feel well after a period of, let's say, 4 to 6 months, there are usually only a handful of reasons. All right. Number one, your doctor didn't run the correct testing. All right. In other words, the testing was not tailored to what your specific needs are. The doctor ran the same tests on you that they run on every other single patient who has the same symptoms. And that is why our approach first starts with a very detailed, thorough case review and health history. Number two, the doctor didn't interpret the tests correctly. In other words, they missed something, and this can happen. Or they didn't follow up to some of the testing that they ran. In other words, they didn't dig deeper into what was found. Number 3, all right, patient just didn't follow the doctor's recommendations. And I know that's hard to imagine, but sometimes patients don't give the process enough time. They want immediate results, and unfortunately, depending on how many layers you have, it's going to take time. You and your doctor must be a team when it comes to working with chronic health conditions. Okay? Chronic conditions don't magically disappear. They take time to stabilize. They take time to reverse. And lastly, sometimes the reason patients don't get better is that the doctor is inexperienced and he or she is chasing symptoms rather than developing a very methodical approach to the root cause of these issues. And so as I bring this video to a close, don't give up if you are suffering from a chronic health problem. And if you're just not finding the help you need, it might be time for a different approach, a different perspective. It might be time for a set of fresh eyes when it comes to evaluating your case. In my next video, I'm going to explain the process of the case review, the specifics of the case review. And if you're considering working with us, please give me 10 to 15 more minutes of your time when I will review all of these things and the next steps. Okay? Take care.